an update and
Thanks, Delia.
identification of future needs from Ken this morning, Commissioner Schatz this morning. Commissioner, thank you. Committee using hand raising, do you have any questions?
And Topper has a question. His hand
Yeah,
is
on my hands up.
Thank you, Topper. I did not see that.
That's
Please
okay.
go ahead.
All right. Commissioner, from what I can take from what you said, in terms of economic services by itself, you seem to be okay. What I'm looking for is there any help that you need from us in that area?
So I do appreciate that question. Thank you. So the reality is we're still gathering information, particularly with respect to the financial implications of this kind of increase. We're certainly appreciative of the fact that the federal government, of course, just passed the stimulus bill. It is complicated. What we need to do first is analyze what money is available with respect to, in this case, it may be TANF, to know how much we're receiving in Vermont from the federal government. And after that, we then would potentially make requests of you for additional financial support. The federal government has made it pretty clear that any state resources that are already committed could not be replaced by federal resources. So we want to take advantage first of the federal resources that are available. So we need a little bit more time to be able to make the request of you, but I appreciate the question.
Thank you.
Are there other questions?
I have a question.
Can you identify yourself?
Yeah, Mary Beth Redmond, and I put my hand up, so I'll lower it now.
Okay.
Thanks,
Topper,
Ken.
Topper, could you lower your hand too? Thank you.
Thanks, Ken, for being with us today and for all your work. I couldn't imagine your job before this event, and now it's just inconceivable with what you're handling. So thank you to you and your staff. I am hearing from nonprofits who are concerned about cash flow, and a lot of these organizations are the boots on the ground organizations providing, this care. And I'm just wondering if there's been any discussion of that relative to money flowing from the state for those who are providing care of COVID-19 patients and others who are kind of on the front lines. Has there been any discussion? We certainly don't want these organizations to go bust in the middle of dealing with this crisis. So I just wondered if you had any perspective on that or any information.
So we're definitely concerned about it and appreciate the problem. And we've definitely been talking about that, and we'll get into that more deeply. Melissa will talk about the efforts were made specifically with respect to childcare providers with exactly that thought in mind, that we know we need to stabilize that system of care. And there are others similar to that. As you correctly point out, we really rely in Vermont very heavily on our nonprofit partners. So again, we're looking at what federal resources might be available to be able to provide enhanced support, both in terms of pure numbers. And again, also, I'll talk more specifically with our business office staff in terms of the cash flow point that you made. I do, of course, get that. And we're definitely mindful of that concern and working on it.
Great. I'm particularly hearing from DAs, SSAs, the whole myriad of nonprofit world. So just to put that in there, but thank you.
No, I do appreciate that. And I know the Department of Mental Health and Dale have been talking very extensively, particularly with the designated agencies, about their needs.
Are there any questions, committee, generally, in a general questions for the commissioner, or can we move now to more specifically childcare?
Okay.
Commissioner, are you kicking us off, or is this something that Melissa is doing? How is this going?
I am going to kick it off briefly and then turn it over to Melissa. So if it's okay, I'll just dive in.
Please do.
Okay. So the reality, again, I know you've been following very carefully the news and honestly the changes. And again, I want to appreciate the fact that we are all being carefully looking to the health department to provide guidance, and then the governor in terms of making priorities and directives regarding the status of activities in our community. And frankly, that's changed over time, even in this relatively short period of time. So again, I want to start by appreciating our staff in the Child Development Division, Let's Grow Kids, and all of our other network of support and providers of childcare, because we do recognize, the governor has recognized, that childcare is actually a critical resource that enables essential persons to go about their activities, whether it's healthcare and first responders, or for that matter, grocery stores. So many things are just essential to keep going, even while for the most part, we're doing our best to stay at home. So these directives have evolved a little bit over time. And again, we have come back to this place where CDD is being asked to essentially provide childcare through our childcare providers in the community for essential persons' children. And we're doing that through a matching mechanism. And Let's Grow Kids have stepped up by creating a tool to provide information that then CDD uses to match with available childcare providers. I will tell you that in context of how quickly we've had to move, how challenging this has all been, I think that the Vermont community deserves a ton of support and recognition for we really are managing reasonably well under the circumstances. So to give you a little bit of data, we understand that the total number of children who are children of essential persons needing childcare is approximately 1,180. The number of slots available right now is a little over 2,000. The point being that at this point, we have a total number of slots that allows us to meet the need. But also, to be straightforward, there are pockets around the state where it's a little bit uneven. There's certain populations of kids where it's harder to meet the needs. And so specifically, and Melissa can talk more about this as needed, but Addison, Franklin, and Essex counties are areas where we recognize there are some gaps. So I think we're working very hard with childcare providers and our referral and support agencies to try to continue doing this matching. Again, as you probably know from both the governor's presentations, and also to be clear, there's a lot of guidance and information on our website. So I want to make sure that you know that that's available and something you can look to for very specific information. We have obviously made an effort to provide financial supports both for families and also for childcare providers. We did reach an approach trying to be mindful of maintaining that support, that we're asking families to pay 50% of their tuition or copay in order to preserve their slots once we get past this crisis period. We know that this is a challenge for some families, but the reality here is in terms of the amount of money that we're looking at, we felt that this was at this point anyway, a reasonable compromise in terms of maintaining the viability of the system, but also trying to support families. So as we go forward, we're continuing to do this matching work, continuing to support both childcare providers and families. And so let me now turn it over to Melissa to give you a little bit more specific information about how we're doing that.
Good morning, everyone.
Good morning.
For the record, Melissa Regal Garrett, I'm the Policy Director at the Child Development Division for the state of Vermont. And I'm happy to speak with you about the efforts the division has made in conjunction with the Department for Children and Families and the greater agency and of course the governor's office around childcare. First and foremost, as Commissioner Schatz mentioned, we've made several pivots in the last couple of weeks. And the staff and team that I've been working with, I would be remiss not to call them out and say they have done yeoman's work, putting in countless extra hours to try to respond as quickly and effectively as possible to numerous pivots that we've faced. First, we focused on stabilizing the childcare system itself. As Commissioner Schatz mentioned, a real value here around having a system that exists on the other side of this crisis, and ensuring that families have slots to return to as well as programs are existing. So we did put in a stabilization program. It's my understanding we're on the cutting edge nationally in looking at it in this way, in stabilizing our system. And we are moving forward right now, knowing that there's an indefinite period upon which we need to maintain this system. We did make a pivot last week to rather than covering 100% of tuition for families that weren't able to make that payment, we're now asking families to cover 50% of that tuition. So then we have also been asked while that childcare system is in a closure period to work with folks to help provide childcare for our essential persons workforce that are required to work outside of the home and have no other resource available to them for care for their children. I want to stress that on every level, the essential persons childcare system is voluntary. It's voluntary for the childcare programs to step up and provide that care. It is voluntary for families to take advantage of that system. And so, you know, with that, it's been a little bit of a different experience for us in managing it. We've approached it from a variety of perspectives, having to really operationalize both financing mechanisms as well as the actual referral system that Commissioner Schatz referred to before. You know, we've had some values and some tenets that we have operated under. We have worked in close concert with the Vermont Department of Health, mostly and highly concerned about if we are providing this care outside of families' homes, how can we do so in such a way to mitigate exposure and to try to help protect the health of anyone that's involved in that system. Really consultation with Dr. Brina Holmes from the Vermont Department of Health under the guidance of the state epidemiologist and guidance from the CDC in terms of how we can more effectively do this. I'll go on to say that it's been a tough couple of weeks. Sorry.
Please, Melissa, you have and your staff have been pulling long hours, been doing yeoman's work, and you're right in the center. And I know it's hard because you've got people coming at you at all corners.
Thank you. So I think I'll talk first about the financing system that we have worked on, and the system has gone through some pivots. Like I said, we had the stabilization system. Part of stabilizing that system did include a pivot in the way we handle childcare subsidy. Previous to the crisis, we paid out subsidies based on actual attendance of children. During this crisis, we've shifted to an enrollment basis. So for all kids that were enrolled in childcare, we continue to make payments to what we're referring to as their home provider or the provider they were enrolled in prior to the COVID crisis.
So, Melissa, as you go through this, I know there's been, it's been an evolving process and there's been changes. So if you can be really clear as to where we are now.
So the decision's been made. We will continue to make those payments through subsidy on behalf of families to the home provider throughout the COVID crisis. So the childcare subsidy system is something that we did not pivot on or make any changes to, as we learned of the lengthening period of the response. What we did change is there are families within the subsidy system that do need to make co-payments to their childcare providers. Those are either built in or they are on top of the co-payments that the subsidy system requires, just because there's a difference between what we pay and what a childcare provider costs. So those families are being asked to cover the 50% of that copay as we shifted that stabilization program.
So what is they're being asked to cover 50% of the copay. What, if you can help us as to what that will mean in dollars per week, and they may, the essential worker may be part of a 2-worker family of which the second worker no longer has a job. So the ability to pay the copay, even 50%. So what happens to them?
What we're saying is just like the entire workforce in Vermont that is making adjustments, either not working or working from home, and are being asked to care for their kids in that home setting, that the same thing holds true for essential persons. So if they are working from home, or if their family member, if they have a family member that is home that is able to care for their child, that they utilize that mechanism and that they don't utilize the external system for care. So with that, again, we're relying on things like the fact that the unemployment program has in fact gotten a boost according to this, as this crisis has evolved. In addition to that, the federal government and the package that they just released does have, payments being made to families and to individuals that have been laid off. So knowing that those pieces are in place, we did move to this 50% cost share program for families, and that applies as well to the copay for childcare subsidy. I don't know the answer to your question on a global or a systemic level, Representative Pugh, in terms of the impact to each family. That's because it's so different depending on, the program that they've selected and if there even is a differential that they are asked to make up. I can tell you, my daughter is a subsidy family, and her childcare program is closed, and her work just announced their layoffs yesterday. And as she went through her calculations, her copay is typically $30 a week, and she will be asked to make a $15 a week copay. She's typically earns about $15 an hour when she's working generally. So I can give you that as an anecdote, but I don't know in terms of how that impact looks across the board. Are there other questions about the stabilization program before I move into how we're paying for essential persons?
Are you all making any involved at all in terms of families who are not part of the Child Care Financial Assistance Program?
Yes, so that's the other stabilization program that we rolled out last week. And essentially it it's rolled out in two parts, and that's because the pivot in the length of time happened, and we became aware of the financial impact of a potential long haul in stabilizing the system. So the first part is in effect through the end of this week. And that part one of the stabilization program for private pay families we are asking Vermonters who can afford to cover their current slot in childcare, their closed childcare program, to continue to do so. If they're unable to do that, that system will pick up 100% of that tuition. With that, we're asking programs to continue to pay their staff, and we're asking programs to preserve the slot for those families. When the crisis is over, families have a chance to return to those slots.
And it's the provider. So the family has to say to the provider, I can't pay for this. And the provider contacts you.
That's correct. We have a system we've operationalized to try to create a structure around that to make it go a little more smoother. But yes, Representative, that is correct. We are pivoting that system at the end of this week to a 50% requirement that families cover 50% of that childcare tuition, and then we will cover the other 50%. We're still asking families that can afford to pay 100% to please do so, but we will cover 50% of that tuition, and with that, again, asking programs to not lay off their staff and to continue to hold those slots for those families on the other side of the crisis so they can return to those.
Thank you, Melissa. Committee, what questions do you have?
And there's a whole list of questions in your, they all have their hands up. Can you see
Well,
that?
No,
And
I can't.
I do have remarks that I can make on the essential persons system and financing and how we're handling referrals. I just wanted to get through the stabilized system first.
Why don't you make some comment? I mean, please continue if you are.
Okay.
If you had.
All right. All right. So as I mentioned earlier, the essential persons childcare system is a voluntary system. We do have values around that. One is the health and safety of those involved. And under that, wherever possible, keeping families together, keeping families in their home programs if those programs have remained open to serve essential persons. And as we've made decisions moving forward, you know, those are some of the tenets that we are really paying attention to. In terms of funding the essential person system, we are offering to any, on behalf of any child that is within and being provided childcare, there's $125 incentive payment that we are making to programs for serving those children. Families that are typically in the childcare system would have expected to pay tuition, and so they may be paying tuition if the provider is charging that. I will just gently remind folks that it's a market-based system, and so there's some levers we can pull in terms of what we can say are requirements and others that we can't. And so tuition may be being charged to families that would typically be childcare families. Recognizing that a lot of families, as you probably are aware, at the end of last week, we were asked to also utilize this voluntary system to support children K-8. Are we okay?
Yes, sorry.
No, that's okay. And so as we've done that, that addition, we did look at this and recognize those families otherwise would not have been budgeting or expecting to pay tuition. And the state is offering a $200 a week tuition payment on behalf of children that are in the K-8 system. So those are the financial supports that we're providing around essential persons moving forward. The system to find care has been a bit of a challenge to set up, and it's involved the cooperation and the work of so many folks, both internal and external to state government. And, you know, I'm going to call out a few of those as I go through and describe this system, but I can't tell you that if it wasn't for private public partnerships, we would not be as far along with this as we are. We would not have had the response that we've been able to make as quickly as we have. Essentially, our partners at Let's Grow Kids were able to really quickly set up a electronic mechanism, a collector tool for any essential person needing childcare to put in their information, and they are twice a day providing the Child Development Division with that data. Our Child Development Division simultaneously has a team of 12 licensors, 4 licensing techs, and 3 licensing supervisors that have been working around the clock to contact each and every one of our private childcare programs to learn if they're closed, if they're remaining open, and if they're willing to serve essential persons. For programs that are closed, we've been collecting data on if they know if they have staff members that might be willing to serve essential persons in other capacities, whether that's directly in folks' homes or moving to a program that's open. We also have been asking if they have facilities that are currently closed, but we know have been regulated, if they would be willing to have an external entity operate within their facility during this closure period. So in this way, we've been anticipating the need to fill gaps, and first and foremost, want to fill those gaps with folks that are within our regulated system, our staff that are already within the regulated system, as well as facilities that have already been regulated. As we've turned our attention to public schools now being part of that process, that has in fact, it is a pivot that we are in the middle of. And so we do recognize that there are folks within the public school that while they may not, like paraeducators or other teachers, have gone through some of the rigorous background checks that we're required to make, they have in fact had fingerprint checks and have been working with children in public school settings. So looking to figure out who among them may be available and willing to provide care. And again, in terms of buildings and facilities, where are there public schools that we may be able to utilize? So with all of that information, both the essential persons that need care and then the facilities that are currently open to provide that care, we hand that, we clean it, make it usable, and provide that information to an existing referral specialist network that's always been present to provide childcare referral services to all families in the state of Vermont. They have been doing an incredible job. They've made 449 referrals for families to childcare in the last couple of weeks. That, to my understanding, is 6 to 7 times annually what they would have been doing for childcare referrals. So just some incredible work by our community agencies and partners on the ground to help these families make the connections that they need. We have identified some places of gaps, as Commissioner Schatz noted. In particular, Addison County has a large gap. We know there are some gaps in Essex County and also in Franklin County. And then finding a little bit of a pattern in the Burlington and Chittenden area for children under the age of 2. So our team is really turning our attention to these gaps this week. We have several strategies that we are using. As I mentioned before, as much as possible, utilizing folks within the current system or programs that have been previously regulated. We are also using the variance option that is within our regulations as effectively and quickly as possible. That mechanism primarily is being used by programs right now in order to serve children in age groups that they did not previously serve, whether that's being able to serve those K-8 students or being able to serve children. We have after school programs that are asking to be able to serve children younger than K-8. A lot of the pattern on that, again, is that idea of keeping families together. So those pieces are definitely in place. We've also asked our partners again at Let's Grow Kids, also at Building Bright Futures, and some of the Head Start local programs are really interested in, is there a way to coordinate folks being able to find family, friend, and neighbor care? So I do know that that work is underway within our partners in that informal system of being able to match folks. I know they're exploring options like Front Porch Forum, potentially some of the nanny services that exist. So trying to figure out, how can we help families that would prefer, or if there's not, if there's a gap and we're trying to address it, how can we potentially use the informal world of family, friend, and neighbor to do that? There have been some interesting solutions, even with childcare programs themselves, where rather than having their staff work in-house, they have sent their staff to the homes of essential persons, perhaps because they didn't have enough of a number of kids. So we are tracking and are aware of some of the unique options that are happening out there to serve families. So I will stop there with some of the more general comments about the pieces and parts that we're putting together. And it sounds like there are plenty of questions to keep.
Thank you. Thank you, Melissa. And committee, I've got 4 questions from you all, 4 questioners. Teresa, then Dan, and then I've got 2 more. Teresa.
Thank you, Madam Chair. Thank you, Commissioner Schatz, and thank you, Melissa, both of you for being here, and which I know is a really stressful time. I just have I'm going to ask, I think I have like 3 questions, so I'm just going to ask them, and then I'm going to mute me, and then Chair will be able to move on. So the first is there any verification process that the childcare providers are continuing to pay their childcare workers? I have had just one report of childcare provider receiving the payments or anticipating receiving the payments, and then still laying off the worker that they had. So that was one. You talked a little bit about continuing the work that you're doing with schools, and I was just wondering if there's any regional differences, because I know that at least some schools in our district here decided not to offer school facilities for childcare. I'm just wondering if you have any other regional disparities around that, and if that's causing any issues for you. And I thought I had 3, but I guess I only have 2, so that's it.
Okay, great. Thanks for the questions. And you're bringing up pieces that we have been absolutely grappling with over the last couple of weeks. I will call out our childcare financial assistance team. We have one of the lowest improper payments rates in the nation in terms of making sure that our providers are actually following the standards that we establish for payment. And this is no different a scenario, even though we are making payments outside of the Child Care Financial Assistance Program. We are using and utilizing the team and the systems in order to ensure as best we can that folks are following the standards that we have outlined. I will say to you that some of this, frankly, is on the honor system of Vermonters. And we see that play out both in terms of this verification as well as the essential persons list. Some of those pieces are, as we are working through this, clicking more and more into place. So as ACCD was able to really identify codes that the Department of Labor uses, it has enabled us to get better at ensuring that these payments are happening properly and people are following those procedures. We do not right now have a system for verifying paying workers. We would appreciate folks handing that information in to the Child Development Division if you are aware of that, because we absolutely will follow up on that. Like I said, we have a team that's well versed in doing research on these kinds of concerns. Our licensor on duty line is our consumer concern line. Same phone number. Folks can call in and just leave that information for us, and we will follow up on that. But I'll take this concern back to the team and see if we can strategize how we might be able to be more proactive about that. Representative Wood, thank you. And then in terms of the schools system, you're absolutely right. There is variety across the state in terms of what that public school response was to that directive from the governor to provide the K-8 childcare. And frankly, we just got that order, that directive from the governor to take that over last Thursday. We did have a little bit of a heads up. And in anticipation of that, we added to our team of folks that we meet with biweekly, external partners with our internal partners. We added Vermont After School. And that partner is proving already to be incredibly beneficial because they were on the ground with schools while schools were trying to make determinations around whether they're going to provide care or not. And so they're already feeding our referral specialists with information about the schools that were willing to do that and how they approached that. Some contracted with external partners to come in and do that work. Some were trying to set that up and establish that on their own. What we are aware of is that schools that were willing to do that work under the directive, now that they know that it's voluntary, are choosing to focus laser sharp on making sure that students have quality distance learning during this closure period of the buildings of public school. And as fellow agency partners to the Agency of Education and to the school-based world, we fully appreciate that task and really support the school folks in focusing on that learning for our public school students. And therefore, you know, as we are helping them by providing this care for essential persons, you know, we're just beginning on the verge of really understanding what that system looks like. So we're setting up a survey.
So Melissa, you're doing a really good job of giving us a really full and detailed explanation of how things are changing and that folks are doing, and I completely agree, the best they can. I'm trying to move you along because there are three other people who have questions, and then there are three people committee who are on the docket to testify, and we have less than half an hour left.
Got it.
Teresa, did you get your question answered the best that we can right now?
Yes, thank you.
Dan, and after Dan, Jessica.
Thank you, Madam Chair. Melissa, I just had a quick question. How are you communicating to the families about the 50% ask? Are you reaching out directly, or are you asking the care providers to reach out? Just thank you.
Yep. Right now, it is in fact on the care providers to do that outreach. We are presently working as a team on frequently asked questions specific to families. That will be a tool that providers can then utilize as they're contacting and working with those families. The only families that we have contact information for are just the child care financial assistance families, which represent about a fifth of the families that use the system prior to adding K-8 to it. So we previously have and continue to not have a way to make sure we can reach
Right.
every family. So there is a
Okay.
leapfrog that happens there.
So Melissa, if you could send Julie a copy of whatever the communication was to the providers since the Thursday shift.
Yes.
When it went from 100% to 50%. Some of us are getting calls of confusion as to what that really says. Thank you, Dan. Jessica, and after Jessica, Carl.
Thank you. So I have two questions. If families who have a child that, and they are essential workers, and they've been in the public schools, so they've never had to apply for childcare financial assistance before, are they able to apply now through your website?
Yeah, absolutely, they can. Our hope is that with the $200 tuition payment that we're making on behalf of those families, and then the added $125 stipend, that's $325 a week per K-8 student, that families aren't, the programs aren't going to need to charge families.
Okay, I wasn't sure if that $200 had to be applied, they had to qualify for it. So that's why I wondered.
It's for each and every essential person.
A couple of grocery store folks have been
Okay.
asking. The other piece is for the other side, not part, they're not receiving a subsidy, but they're an essential worker who works in an area, this actually is in the intensive care unit, worried about the other children, like their child catching something from them, not wanting to put them in a full childcare center, have gotten support through hiring one of the folks who worked in the childcare center in their home, but also need to pay 100%, they think, of the childcare at the site so they don't lose their spot, because they're hearing that if they don't pay 100%, they're going to lose their spot, and wondering if that's really fair, is really okay. And it sounds like what you're saying is 50%, but this is someone who's outside of the CCFAP program. So I just wondered how that works.
So again, it's a market-based program, and all of the things that we've set up are voluntary. So a childcare provider on an individual basis that chooses to access our stabilization funding for that family, that non-CCFAP family. Right now, this week, if that family can't make that payment, we will pay 100% of that tuition on their behalf. Starting next week, we're asking that family make 50% of that payment. If that childcare provider is not opting into our stabilization program, that is a relationship, a market-based relationship that we are not able to really get in the middle of. So that scenario could be happening, Representative, if the childcare program is not engaging in the stabilization program.
Thank you.
Okay. Thank you, Jessica. Carl.
Thank you. This question's for Melissa. I've had some providers who have brought to my attention that some of their staff think it's unfair that they're working to provide care to essential workers, and yet there are child care centers that where people are being paid but aren't providing a service to children at this point in time. My best explanation is it's an extraordinary time, but we're going to have some what appear to be inequities. But I wonder if you have something maybe more concrete that I could tell them.
Absolutely. So again, it's a voluntary program, and we looked at it as our approach was really around incentivizing the programs to continue to provide this care for essential persons. So that's what the $125 stipend for each and every child was really an effort around. We can't tell the programs what to do with that $125 per child stipend, but it would certainly be our hope that that would result in additional salary or bonuses or some sort of compensation for the actual staff members that are doing that care.
Thank
Thank
you.
you.
Thank you very much. I still see hands raised. Teresa and Carl, do you have other questions for Melissa, or can we move on to Sonia Raymond?
Sorry, I forgot to take my hand down.
That's okay. That's okay. Topper, do you have a question? Okay. A quick question. We got 3 people in half an hour.
Quick question. Why can't you tell them that subsidy, if you've got people that are being paid and not working, and you have people that are working allegedly voluntarily? I don't know how that childcare center could stay open if they were doing it, if they didn't come to work. Why can't you tell them to use that money to provide more not assistance, but pay to that worker that is in fact on site working, whereas the other one is not working and being paid fully?
Mm-hmm. Again, it's not something that we have ever gotten in the middle of, even with the Child Care Financial Assistance Program, where we pay tuition on behalf of children to attend a program. They're a private business, and they're really setting up their budgets and making their businesses work. I think that you're probably accurate that they're not going to attract people to come in and do this work if they're not offering them additional compensation. Keeping in mind that these folks aren't not compensated, they should still be being compensated under the stabilization program. It is highly likely that the WAVE programs are in fact getting folks to be willing to do this in an ongoing way would be added compensation.
Thank you. Thank you, Melissa. Thank you. Topper, I'm sorry. We got
That's okay.
We got 3 provider people who would like to, or
Yep.
versions of that I think would be important that we hear from. And what I would be looking for, committee, as we think short and medium term, and Commissioner, as we're thinking short and medium term, if there is something that the legislature needs to do to address some of these issues. Sonia Raymond, you are the Executive Director of the Vermont Association for the Education of Young Children.
Yes, thank you very much for allowing me to speak today. I'm also the owner of Apple Tree Learning Centers in Stowe, so I'm going to be speaking from both perspectives a little bit today. Just in terms of our role with AC and what we are doing in the throes of this, is we have sort of become, as I'm sure Let's Grow Kids and many other statewide organizations have become, sort of the go-to points for a lot of the programs in the state. So when they have questions, they are coming and looking to us as statewide leaders to provide those answers as best we can. So we have spent a lot of time working with the different organizations and agency to try and get that information out to people as quickly as possible to stave off any confusion that we can. Not that there isn't any, because there is, but it's in an effort to work, with our partners to help that. So we've been sending out a lot of communications over the last 2 weeks and answering lots of emails and phone calls, as I'm sure many other folks have. I was asked to talk about sort of the general impressions. I have to say the package that Melissa spoke to is gotta be the best thing going in this country. I can't imagine anything more supportive for this industry. We entered this this situation 2 weeks ago, and business owners and providers were absolutely scared out of their mind. They are generally a week to 2 weeks from closing their door in the best of circumstances. And what has been put together as a financial package that Melissa just described is unbelievable, frankly. And it does allow, if people opt in, it does allow for programs to come out the other side of this and be able to provide a service for families again. It isn't perfect. I'm not sure we could put together something perfect, but it does work and it does allow for that. I will say most of what we're hearing with regards to that package is just some confusion about how it's working specifically and what they're supposed to be charging or not charging to whom and how, and not knowing who to speak to specifically to get answers. And so the one thing that I would say, if it's all possible, is to have, if we can have some sort of central housing for who you call or how you get your answers in the quickest possible manner, that would be great. Because what people are tending to do is go to their licensors at this point. And the poor licensors, they don't have all the answers to all of this. They're doing the best they can. Plus they're trying to work with the programs that are still open and those that are closing and figure out how to help them manage things. But I can say that that would be super important at this point for clarity around all of this. And, you know, I want to speak to the essential care piece, if I could, for a minute, because Apple Tree has chosen to remain open. And this wasn't after a great deal of thought. I could see the writing coming a few weeks ago myself on the wall, and thought a lot about this idea before I was even asked if I would be willing to do it. And well, I couldn't agree more that best case scenario is that every family have access to having care from, you know, a family, friend, or neighbor for the least amount of touch points for the family as a whole in terms of possible infection and for some continuity. But I think given the circumstances, what is the folks that are choosing to do this are doing is providing something in the interim, particularly because there are many families that actually just don't have access right now to family, friend, or neighbor that they can actually get this care from, or feel that they don't have that. And so for us here, those are most of the families that we are serving, families who don't have other family in the area, who live in very rural areas, who don't have close relationships perhaps with their neighbors, or neighbors who are not comfortable watching their children, knowing that these are people going off to work in hospitals and grocery stores every day. Lots of reasons. And our numbers are very small, right? We have about 12 people enrolled right now. We used to have 95 a day. So that goes to show you that Vermonters, in my opinion, are really trying to do the absolute right thing by their families. And for us, to the decision to open and do this was to fill the need. And I can say that we did it initially, and then we decided not to do it. And then we reopened when this new package and incentives came out for the essential providers. And I'll tell you, that $125 that you were just asking about is a big deal. It's actually what allowed me to feel okay about this for my staff, because I was losing my staff every day that had agreed to do this initially. They were getting scared. They make like $15 an hour. They, you know, if they don't have health care, then what happens if they get sick? So for me, this $125 is going directly to my staff. Those that are staying, it's going in their pockets, not mine. And I really hope that that is what people are planning to do with this funding. And from the providers that I am speaking with, that is exactly their intention. It is to put it into their program, to be able to stabilize their program and to pay those workers that are staying and working a significant increase, so that they can access healthcare they might need and have not felt they could do the premium on before, or to just for their family whose spouse may have lost a job. So I do think that this has been a very important piece to have in place. And that was felt to me a direct response to having heard, I am sure, a ton of feedback from me and probably lots of other folks that we probably wouldn't have programs willing to stay open very long if we didn't do something to help the staff feel like they could do this and not fully, jeopardize their families. So I could say a lot more, but I know that we have three other people that would like, or two other folks that would like to speak.
Sonia, this is Representative Pugh. $125 per child is a good incentive. What else do you need, either monetary or, and I'm speaking to you when you, as the executive director of the Association for Education for Young Children, short term and then medium term, either in terms of funding or policy changes?
I think, the basics of businesses will be covered. I can see that there might be some gap funding needed. I think what programs that the ones that I'm speaking with are doing is really paring their expenses down to absolute bare minimum. But as this stretches over time, the longer it goes, I think some of those cuts are going to become quite vital to their business, and they may need help to bring some of those back. So I can see that perhaps needing change. The other thing that I would encourage some change in, if possible, is some policy around healthcare. We provide healthcare actually at Apple Tree. That does not mean that everybody can afford it, even though we're paying half their premiums for them. And I think for this industry, anyone who is choosing to stay and do this type of care should have, and I know they can access it now through the state system, but it does not mean it's affordable for them, or at least that's what I'm finding with my own employees at this point. So whatever we can do to help that situation, I think would be important.
Thank you. With the exception of Topper, who's not on mute. Topper, do you have a question for Sonia?
No, I thought I
Okay.
was on mute.
That's okay. I don't see any questions. Sonia, thank you very much. Thank you for deciding to reopen. Appreciate it.
You're welcome.
Floyd Neese is next. Floyd is going to speak from the Lamoille Parent Child Center and the perspective of parent-child centers.
So first of all, thank you all for paying attention to these issues. It's a matter of crucial importance right now. And I hate to be the bad news bearer, and I admire people like Sonia who has, am I still on? My computer
You are still on, but this is, you're on at the bottom. But what you submitted for testimony, since we are on YouTube, is up there for people to look at.
Okay, so you have my testimony written, and I'm just going to cover the highlights.
Okay.
Okay, first, asking child care providers to provide care in a congregate setting in the context of a governor's order that says stay home and stay safe. Those two things are in conflict. And I think that you're asking an awful lot for $125 a day of people who are really taking great risks by going to work every day. There are a bunch of questions that arise. One is, how do you maintain social distancing among active children in a congregate setting? How do you do that with toddlers? How do you do that with infants who need to be changed, who need to be held? So we have several PCCs that have child care facilities, but don't have staff for them. And because their staff have either to They need to care for somebody at home. They've got their own kids. They got to do homeschooling. They're in a risk category. So there are no staff. So some of those parent-child centers have been asked to reopen their childcare facilities using some other caretaking arrangement like volunteers, teachers from area schools. And that, you know, my legal counsel went nuts when he saw this, because there are so many liabilities that present themselves that it's a real risk to the organization itself, ultimately. What happens if somebody who is attending your childcare, one of your children, gets COVID-19? What happens then? Does the place shut down? Are you liable? Is it a workers' comp issue for the people who can't come to work anymore? It's a bundle of issues that haven't been addressed to date. And you can see I've got them in there so you can take a look at them. But so speaking for myself and not for the network, I want to say that I believe that, I'm reading this, I believe that caring for these children in congregate settings puts them and their caregivers at great risk. It would be less risky to care for them in their own homes with relatives, neighbors, or friends. I've let my staff know that that if they want to, they can volunteer, or they can decide to provide care in someone's home, and that we will help them do that if they feel like they can. But if, as a last resort, volunteers are used in children's homes, it would make sense for them to have an off-site infrastructure that they could call on for support, a hotline like to Building Bright Futures, that they could reach out to with questions or if an unanticipated challenge came up. Finally, this emergency has brought into sharp focus the fact that the person cashing us out at the grocery store is as critical to our daily lives as the doctors and nurses caring for those who are ill. They should not have to put their children at risk while they themselves are at risk where they work. Schools are closed for a reason. School districts across Vermont have largely been unable to fulfill this directive for many of the same reasons. And districts that did begin to provide that care are now shutting them down. Barrie is a case in point. It's an unsustainable and unsafe model with serious liability should anything go wrong. Closing congregate childcare settings for all but the children of essential personnel means that the only children being put at risk in that way are the children of essential personnel. We have to find an alternative, and I think we can, but we can't put kids in a congregate setting and put them at risk in this way. And that is all the bad news I have to give. But I do want to say one other thing, and that is that parent-child centers are in the same boat as DAs and SSAs with regard to cash flow. Just wanted to point that out. Thanks.
Thank you, Floyd. I'm just so that we are clear. Are you speaking for Floyd Neese and the Lamoille Parent-Child Center or are you speaking for the Parent-Child Center networks broadly when you say congregate childcare should not be the option?
I think I can say that I speak for the vast majority of the Parent-Child Center network.
And so that people should be going to individuals' homes?
Yeah.
And
yeah, I think, you know, if my child is exposed to 10 kids, or I'm sorry, 8 kids, because there need to be 2 adults in the room, to 8 kids in a given day, and those 8 kids are exposed to their caregivers at home and whoever else they're exposed to, there's a multiplicity of risks there that's pretty significant.
Okay. Committee questions for Carl. Teresa, I see your hand raised.
Thank you. Floyd, I just want to ask you a question about the last statement you made with regard to cash flow. I guess I'm making an assumption that if you have people participating in the Child Care Financial Assistance Program, that you're getting the same payments that other child care providers are receiving. Is that accurate?
That's correct.
Okay, and then my second question is with regard to the base payments, the grant payments that the Agency of Human Services makes. Have you received any notification that there would be any change in those?
No, we have not. In fact, we made a point to the Agency of Human Services that it would be great if they could pay some of the accounts receivable early, and they have.
Okay.
So, I mean, the truth is that I don't think anybody's on the edge except perhaps in Rutland or where else? Anyway, I know Rutland is on the edge anyway, but so I don't think we don't need any emergency intervention at the moment.
Okay, thank you.
But we can all see them coming.
Thank you.
And Floyd, as usual, you have brought up some hard points and some things that we need to balance. And later this week or tomorrow or next week, we'll be talking more about short-term and midterm solutions or responses. But the last person to testify and provide us with information today is Allie Richards, who's the CEO of Let's Grow Kids, who have stepped up as an organization.
Thank you so much, Representative Pugh, and all of you. I'll try to be brief. I know we don't have much time left. Okay, so I just truly appreciate the ability to share Let's Grow Kids' perspective right now in such a difficult time. I'll pretty much, as the last person on the roster, be kind of underscoring a couple things and reacting to a few things. But I think it's helpful to know that the second this happened, it became an all hands on deck situation, and we've all been saying, and so we ceased pretty much all of our normal activities at Let's Grow Kids and pivoted to working hand in glove with the administration, but also the early care programs on the ground, Sonia mentioned, our federal delegation, and the state and national advocacy groups. There's a lot of great TA and shared learning, and people are knitting all of this together. And so we're trying to be kind of a bit of a clearinghouse to between all those various supports and sort of new information coming and going. So I think it might be helpful for you all just to hear what we've been doing, which really puts into focus what Melissa mentioned as a public-private partnership, maybe give you ideas of other things you might even request in the coming days and weeks.
I think that latter part would be very helpful right now.
Perfect. Wonderful. Okay, so here's a summary, and then I'll just make 2 broad points at the end and open up for questions. So we're basically collaborating with the state to be a resource for childcare programs and early educators on the ground right now. Part of that looks like collecting feedback from the early childhood field, relaying their concerns, triaging their concerns to the state and other policymakers, as Sonia mentioned. We're also putting resources very regularly updated on our coronavirus website at Let's Grow Kids. And I think I want to make a note that this is for early childhood educators and families and employers, who are 3 key constituency groups that have risen up with needs and questions in this. A lot of guidance is coming fast and furious, and some of it's not really digestible. So we're both posting it directly and helping to digest to make some of that a little bit more accessible for these groups as well. So that's constantly updated on our website. The other big bucket of work we're doing, has been alluded to by many, is this emergency care now for essential workers. Okay, and I want to just make a couple key points there. So as Melissa said, we're partnering with the state for that intake. It's purely intake, and then it's passed right on to these CDD and these systems, the referral in place. But what we're also doing is really focus on the health concerns. So just as a quick, and I'm not the bottom line on this in any shape or form, we're working closely with CDD and Brina Holmes at Department of Health. And all I can say is we've been advocating very much, and to people who are listening very closely, to make sure that those who are doing this care have access to the absolute best health guidance possible. And sort of the next wave of that is looking at health insurance and how can we think about, sort of expanding that and supporting that to these folks. But we co-hosted a webinar on the health guidance. And I will say, in sort of speaking with Brina, They are thinking about what Floyd is saying very, very carefully, and they're looking at guidance. They're looking at best practice. They're also looking at a lot of data that's coming out of epicenters around the world and in other places in this country, and seeing that actually in very, very small settings, with a lot of hand washing, the risk is quite low, that young children really are not vectors of this in many ways. So all I will say is I know a lot of thought is happening with good public health guidance there. And I would bring up something that Vermont AUIC or National Association, NACI, has said time and time again, which I believe is really ringing true for folks at a time of crisis like this. Really highly qualified and prepared early childhood educator is an incredible resource. So in those cases where these children of essential workers can have that access to this care right now is actually a wonderful thing for them and their families during this time of crisis. So finally, we continue to advocate for financial incentives and supports for these programs, and the state is doing so much good work there, as you heard from Sonia. The other thing that we're doing is we're supporting the programs that have closed. To do a series of things. You know, some of them do need bridge loans for a variety of reasons. There are some small gaps that are still arising. So we're helping put a hotline together to get early educators. Wonderful people have stepped up. We're paying 50%, you know, and folks are doing 50% pro bono, people that you'll know around the state that do this great work, a lot of legal firms, to give unemployment insurance advice and other HR related advice to this field right now. And working with VSECU and the Vermont Community Foundation on some bridge loans to fill some of these gaps. We've heard from so many people that want to help that we've set up an emergency fund for childcare and have a really wonderful response. And that money can be used for some of these things. And we're really making sure that any federal and state policies really do take into consideration the childcare industry and the specific needs so they are not sort of left out in any way. We're also supporting families right now. They're really struggling in a variety of ways, making sense of this, being at home with their kids. The good news is a lot of the childcare folks that are open right now are doing great work actually with continuity of learning. So I'd say we're actually now supporting some programs in doing that continuity of learning, what it looks like for childcare folks at kids of this age, how to support families and their children right now as an early educator that's, you know, not physically seeing those people every day. We're also really helping to support ramping up professional development for this field right now, while they are still actively working and on payroll. We're also really supporting employers on what flexible sort of benefits look like for their staff right now at this time, having them step up to support childcare in a variety of ways. The last thing I'll mention is we're pivoting to supporting more of this informal care, as sort of Floyd saying. It is a piece of the puzzle, as Melissa said as well. And we've been working with CDD, and at this point, it really looks like setting up resources for families to access these informal networks. And I will say one really bright spot is a lot of medical students can't be working right now because of the crisis, and they are background checked and they have first aid and they're ready and willing and raring to do this. So we're sort of thinking about ways basically to link them and other folks up like that who want to go into people's homes and be a part of this puzzle that we're all sort of seeing come into shape now. And so that's continuing work that we're doing with CDD. So really two final things I just want to say. I just have to thank you all and thank the state of Vermont. As others have said, we are the best in the country right now in this moment. We're following best guidelines, using CCFAP flexibly in the way that, by the way, you all have said in your 5-year redesign plan, it should be used, you know, not only in a time of crisis, but generally like this. So it's the right direction. Your groundwork and thoughtful work on this has helped put us in this place where we're the only state right now that has said, we're going to be darn sure you can open up your doors when this is over. This is such a vital resource for us, and we're going to make sure of that. And now these folks don't have to worry about being bankrupt while they do this continuity of learning for their families, while they do crisis emergency care for essential workers in some cases. That is so huge. I have to underscore that point. I also have to say, you all know this painfully well too, the lack of having a modern IT system right now for CDD and AHS is crucial. It's impeding efforts. States that have made these investments, like the ones that you've already set in motion, but we haven't finished in Vermont, have made things so much faster, identifying gaps, linking people to care. It's just really, we'll continue to find huge points like that in this crisis together for policy moving forward, but I just have to mention that one. So all that is to say, I would urge you all in understanding sort of the magnitude of both the problem facing, the early care programs and the significant stepping up that the state has done to really support this industry.
Thank you.
I'd love for you to make sure that you're looking at federal and state dollars to support and basically back up what the state has done.
Thank you. Thank you. Someone has their something on because there's a reverberation. Carl, you have the final question in the last minute that we have. And clearly folks who are listening, we'll be continuing conversations around childcare and where to move next. We've spent a lot of time this morning saying what people have been doing. We need to know, we need to move forward and what needs to happen forward. And Ally and Melissa, thank you for, and Floyd, thank you for identifying some of those things. Carl.
Thank you. My question, I don't know whether it be Melissa or Ally could answer this, but is it true then that somebody that, let's say, was working, providing childcare for essential workers in a daycare facility, and they ended up having to stay home because they thought they were contracting a cold or something like that? Would they be going on unemployment, or would they be going on what do you call it, workers' comp?
Melissa, do you want to take that one?
Sure. What we understand from our partners at the Department of Health is that because this is such a community-wide and widespread contact scenario, there really is no exact way to pinpoint where someone may have come in contact or contracted COVID-19. Therefore, this is not a workman's comp issue because there's no way to actually prove that someone had that contact and actually contracted COVID-19 from a child care program.
Thank you very much.
That's a good, clear answer. What I would ask committee, thank you for this last hour and a half. If you have questions for any of these folks that we've heard from, if you could write them down and email them to Julie Tucker, our committee assistant, and myself, committee members, we will see how we can get them back to, or someone back to us to answer them. But clearly this is the first step in where do we go from here? And we'll be having that conversation, if not in another meeting this week that's not scheduled, or at the very beginning of next week. Committee, thank you very much. We're going on our lunch break and we're coming back at 2:30. Help someone, coming back at 2:30, where we're going to be talking about Woodside. So thank you all very much. And this is the end of the morning for House Human Services. Bye.
Thank you.